Hello, I'd like to welcome everybody to this meeting on COVID tracing apps and what Ireland should do. As you may have heard in the news today, it is likely that the app will be released very soon, possibly tomorrow or early next week. And this meeting is very timely in discussing what these apps are and how they should be designed and delivered, and what use they and other technologies can be in the fight against COVID-19. This is a meeting that's jointly organised by the Digital Repository of Ireland. My name is Aileen O'Carroll. I'm the Policy Manager at DRI, the Irish Council of Civil Liberties, and Coffee on Circumvention, which is an informal gathering of people who are interested in privacy, security, and protecting our democratic rights in the digital age. We have a panel of interest who are going to discuss the issues around COVID-19 technology and the app in particular, and what the issues are for both Ireland and internationally. So I would like to let everybody know first I'd like to welcome everybody for coming, even though it's a very sunny day, and I hope some of you are listening out in the sun. I'd like to let you know that the meeting is going to be recorded. We'll take questions at the end, and you can send questions to us through the question and answer button, which is at the bottom of the screen to your right. I will relay the questions to the panel. If you would like your name and affiliation to be included in the question, please add it to the question. Some of these issues are very technical, and we're trying to address a general audience as well as an audience of experts and policymakers. So if there's a term and a word that you don't understand, do ask for clarification. And if there's time, I'll ask the chair, I will ask the speaker to clarify as soon as possible. The meeting is being broadcast on Facebook, on the Maynooth University Social Science Institute Facebook page, and will be available afterwards along with the slides at the Digital Repository of Ireland. If you're tweeting the meeting, we encourage you to tweet. We'd be delighted if you would do that. The hashtag for the meeting is hashtag COVID-19 apps. So we have 4 speakers, and each speaker will speak for about 10 to 13 minutes. And then afterwards, we'll throw it open to a discussion between the speakers and to, of course, your questions. So I'd like to introduce the first speaker. She is Carly Kind, who is the director of the Ada Lovelace Institute based in London. The Ada Lovelace Institute is an independent research and deliberative body whose mission is to ensure data and AI work for people and society. She's a human rights lawyer and a privacy and data protection expert. Her work focuses on the opportunities and challenges that arise at the intersection of human rights and technology. Thank you very much, Carly.
Thanks, Aileen. Thank you so much for having me. So the Ada Lovelace Institute has been working on digital contact tracing in the context of the UK for the past 3 months. So I'm going to talk a little bit about what we know at a relatively high level about digital contact tracing, how it works, and I'll give you a couple of insights into the UK's experience with it. So in April, we published a report called Exit Through the App Store, where we looked at the different types of technologies that are being proposed as a way of helping the transition out of the COVID-19 crisis. And we look at these technologies from the perspective of their technical considerations and their societal implications, and with the broad understanding that everybody who's working in government, outside of government, in the private sector around these apps is absolutely well-intentioned and really working, in fact, working overtime to find a way to use tools to mitigate the impact, the long-term impact of this crisis. But when we started to look into digital contact tracing, we found quite a lot of things that not only were promising, but concerning about the technology in the context of its effectiveness, as well as related issues like data and privacy protection. So I'm going to go through the kind of range of different considerations that we flagged when it comes to digital contact tracing. So first of all, it's important to know that, and many of you will know this now, having been avid consumers of news as we all are these days, there are different design options available when you're talking about digital contact tracing app. There's not only one way to do digital contact tracing. And in fact, it should be said that prior to this crisis, there wasn't any ways to do digital contact tracing. It's a new technological intervention that has sprung up relatively purely in response to COVID-19. In previous pandemics, mobile data was used in different ways to do manual contact tracing, which is when people try to track the spread of a virus using in-person interviews. And in some previous crises, mobile data sets were used to do that. But in terms of real-time tracing, using an app, that's not been done before this crisis. So we're also talking about a technological intervention that's being developed in speed in the context of a global pandemic for the first time, and being really trialed on the public. So there are different design options, and there are different legal options around these apps, and different countries have pursued different approaches. So one aspect will be whether an app is mandatory or whether it's voluntary. In most Western European countries, I would say it's voluntary to use an app. In some places like India, it's been made mandatory for workers, for example. And then there are hybrid situations where it's not mandatory across the country, but it may be mandatory to access certain services. Or, for example, it's possible that it will become mandatory to use one of these apps when crossing borders in Europe going forward. A second question is the way in which infections are reported into the app. So a confirmed COVID diagnosis or a confirmed COVID test is required in order to input data into an app. In other places, such as the app proposed by the UK, it was based on self-reported data. So individuals could say, I think I have COVID, and that would form the basis for the contact tracing app. Then there's a whole question around the protocol, which has been really live in recent weeks. So this question of does it use a bespoke Bluetooth protocol designed, for example, in the UK, but other countries have followed a similar path? Or does it use the Google and Apple API, which is a different protocol and has different implications for where data is saved? And the issues that I've listed here, how is the data collected? So in the Apple Google protocol, it's based on data which is collected and stored only on an individual's phone, whereas in the UK proposed app, it was based on data that would be collected and stored at a centralized level. Questions around data access, so who has access to that data? Using a Google Apple API, for example, only the individual would have access to the data, and then they could share that in an anonymized form, whereas in the NHS app, the data was accessed at a central level by the NHS and potentially other government actors. Then there's a question of how does an individual get alerted that they've been in contact with a person who either reports or has been diagnosed with COVID. So, what messages do you receive? What does that message tell you? What type of notification? In the NHS app, they were thinking about doing a kind of traffic light type set of alerts. So orange alert would be you've been in contact with someone who's self-reporting symptoms. A red alert would be you've been in contact with somebody who's now had a confirmed diagnosis, for example. And then what are the actions that the app alerts you to do? So does it tell you to stay home? Does it tell you to go and get a test? Do you stay home for 7 days? Do you stay home for 14 days, etc.? So there's a lot of different design choices that could factor into any app. I'm wildly aware that I'm definitely going to go over time, so I'm going to race through the next section. So some of the technical limitations might include Bluetooth technology isn't very good at detecting when two phones have been in close proximity to each other. So we know, for example, that if you're in a room separated by a thin wall, Bluetooth might detect that you've been in contact with someone. But of course, you're in a different room to them. So that's a kind of limitation of the technology itself. There's also a question about how close you would need to get to another person in order for that to register as a type of contact in which you might transmit the virus itself. And these are questions of public health as much as they're technical questions. There's a question around how vulnerable the system might be to fraud and abuse. So could you, I don't know, tie your phone to your dog and let your dog run around and cause a whole range of different contacts? Could people self-report data inaccurately? I mean, I don't know why people would do that, but how would you build a system that doesn't permit that type of misuse. And then there are more kind of sociological barriers to deployment, which are around public trust in the technology, and that's very closely tied up with the question of effectiveness. So one thing that we hear from epidemiologists is, in order for this type of system to work, you would need a minimum threshold of people in a country using the app. In the UK context, we were told it was 60% of the population, which is 80% of smartphone users. And then any number below that, it's somewhat unclear as to the extent to which, what public health benefit is gained from using the app. But that feeds into this question of, does the public trust it? Does they have confidence in it? And how do you increase public trust in it? And the question of public trust, I think it's fair to say, is heavily dependent on some of those design options. So options which require more centralization of data might be less likely to enjoy public support. Then I think some of the other social considerations that we need to think about is how an app might exclude vulnerable groups. So in particular, people who don't have access to digital devices. In the UK, that's about 20% of people don't have a smartphone. And as yet, we don't really understand what provision in the NHS system there is for allowing for those people to be brought within contact tracing. It turns out that the people who are digitally excluded may also be the same people who are most likely to suffer the ill effects of the virus, given the death disparities that we know fall along ethnicity and social lines. So how do we account for that type of unequal impact of the app? And there's also the question of, if an app is instructing you to stay at home for 7 to 14 days, what support in terms of social support or financial support might we need to put in place? Keeping in mind we might be relying on these apps for a year, 2 years time. If you then have to take 2 weeks off work in order to comply with an app's instruction to stay home, how do we make sure that there's the necessary support systems in place? Just very briefly, if you don't mind moving to the next slide, I just wanted to highlight, in the UK, we laid out a range of different requirements in order for the UK to proceed with a contact tracing app that would meet the thresholds of public trust and confidence and questions of human rights as well. We focused on the need to demonstrate efficacy using trials and pilots, and to do that in public, to have impact assessments that were published and able to be scrutinized. We also argued that there should be legislation and a broader strategy around the app, and I'm interested to hear how that's being thought about in Ireland. In the UK, they certainly were disinclined to take any steps to introduce primary legislation, but I think there is a strong argument for using primary legislation to really buttress a system like this and increase public trust. And the trust is the third component of this. And we argued as well that, well, my apologies. We argued as well that we should be thinking about oversight mechanisms, ongoing scrutiny, ongoing review, in order to really reassure the public that this is something that's been watched over and made sure it's being implemented properly. I've definitely used up my time, so I'm going to stop there, but happy to answer any questions.
Thank you very much, Carly. That was great. I just have one quick question. When you were talking about protocols, or there was different types of protocols. Mm-hmm. You mentioned Bluetooth and the Google API. What is a protocol for somebody who's?
Yeah, sorry, I know I went through about that a bit quickly. I mean, the way we use protocol in this app is essentially the technical mechanisms by which the app works. So with these contact tracing apps, some people are declining to use the word contact tracing, and they're preferring talking about exposure notification or proximity notification. Essentially what it is it's taking your phone as a proxy for you, and it's following your phone around and looking where your phone comes into contact with other phones who are proxies for other people. And the way that that's done technically is by turning on your Bluetooth, which basically broadcasts a signal, and whenever your phone is close enough to another phone, they'll broadcast at each other, and then they'll keep a record of that interaction. In some countries, they're not using this Bluetooth system, they're using GPS, which is a completely different protocol decision. But as I understand it, in most Western European countries, we're talking about a Bluetooth system. And then the other aspect is how the the contact itself gets registered. So under the Google Apple API, it gets turned into a memory, in a way, part of your phone's memory that's stored on your phone. And every so often your phone downloads from a server some information about people that have been diagnosed with COVID, and it goes back through all those memories and says, was this phone near any of those people, and then lets you know if that was the case. In the UK system, the memories were being stored at a central level with the NHS, and then they would run an algorithm against that in order to detect any interactions.
So when people are talking about the two options between centralizing and non-centralized, it's about where the information is stored, whether it's on your phone or whether it's on a central server somewhere else.
That's correct. And I mean, the central server situation was done in a way that was, you know, there was some strong privacy protection. So it's not as black and white as on your phone private, in the central server not private. There are kind of a range of different protections. But I think a key additional complicating factor to note is the centralized version, because it had been designed by the NHS, it was having this adverse effect where it wouldn't work on some phones, in particular iPhones. It didn't work very well on iPhones, essentially because they were designing the software and they were trying to fit it against hardware, which is your phone, and there was they were rubbing up against each other. The benefit of the Google Apple approach is Google and Apple have made basically all the phones in the world, or at least, you know, in the countries in Western Europe, or most of the phones in circulation. You know, places like China are obviously different, but so they're able to design a software that better fits with the hardware because they made the hardware as well. So it works, it functionally does work better with the Google Apple API than it does with a centralized version.
Thanks very much, Carly. That's you made it very clear, and it's not easy to express these technical terms in clear ways. I'm going to hand over to Art Suryawonkun now. He's a co-founder of the Thai Netizens Network and a PhD student at the School of Computer Science and Statistics at Trinity College Dublin. His research is on artificial intelligence ethics, privacy, and related regulatory technology. He's based at the ADAPT Centre for Digital Content Technology and funded by the SFI Centre for Research Training in Digitally Enhanced Reality. Art, can you, there you are. Thank you very much, Art.
Thank you for having me. Hi, everybody around. So I think just carry on Carrie's points, right? So I put a bunch of links, right? If you can see on the slide, right, you can see more information from those articles, and there's another spreadsheet that I compare a couple of apps that related to COVID, right? But then I think one of the things that we need to also consider as well, it's what's actually the purposes of these apps, right? Contact tracing, right? Or exposure notification, or whatever the terms. That's one kind of functionality, right, of the app, that when we're talking COVID-19 apps, right? That's only one thing, right? In a lot of countries, there's a tendency that you probably combine all the kind of functionalities into the app as well, right? For example, the self-assessment, right? Oftentimes also come together with this contact tracing, right? So people install this contact tracing app, right? In order to keep records, right? Whether you got exposed to whichever phones, right? What Kelly explains about the phone as a proxy of a person, right? But that's only one thing, right? The same app can also maybe ask you questionnaires, right? Have you been into the foreign country before? In which cities, right? Or what kind of activities that you do, right? Or for example, some professions may be more exposed, right? Than other professions. For example, if you work in the healthcare, if you work in the in supermarket, right? Which there's a lot of people, maybe you are more high risk. For example, in Thailand, in a lot of countries, right? They actually use these questions to with some algorithms, right? That like to in the end give you rating, right? If you actually like more at risk, right? And then like maybe like give you some suggestion, right? Which is like leads to another aspect of this app, right? Which can be works as a informational app as well, right? Provide correct information when in the situation there's a lot of like misinformation, right? About the COVID-19. So with these purposes, right? I think we actually have to be really clear what are the objective, right? Or what we actually expected, right? From having an app, because this will also lead to another thing that we should consider as well, about like what kind of permissions, right? Or in which situation that a person should or shouldn't install this, right? I think like in the case of Ireland, right, in a lot of and also a lot of Western like European countries, fortunately, right, it's actually more on like voluntarily basis, right? You not actually got forced, right, as a mandatory that you actually have to install the app, right? You can actually choose whether or not, right? Depends on whether you trust the operator of this app or not, right? But with these purposes, right? I think we need to know about the purpose, what you actually expected, right, from installing this app, and this will be the basis, right, to go to the next point about the permissions, right, that these apps actually ask from your phone, whether it's actually sound or not. Example, right? If if the app said that like the only purpose of this app, right, is about detecting whether you actually get exposed to the people who has a high likelihood, right, of or maybe like have a COVID-19. So maybe the permission that the phone asks from you, right, when you going to install and use the app, it probably only asks you for the permission to use the Bluetooth signal, for example, right? It shouldn't ask you that like you to give them the permission to get the GPS or to get the access to your camera or to record the audio, for example, right? So and also like kinds of like data that going to collect that as well. So that's on the end, on the about like the technical permission that the phone actually asks from you when you install the app. There's another end as well about the in which situation that like, I mean, basically which person should or shouldn't got advice to install the app. For example, if the purpose is about the quarantine, like self-quarantine, it should only be the person that already got the advice from professional, for example, right? That like, okay, you are actually a high risk, right? So and this quarantine app in a lot of countries, like we ask like, okay, they will just detect you using like GPS, using the mobile phone antenna signal, right, to detect whether you actually like at your place or not, right? So and not moving around and making like more create more risk to other people, right? So it in this case, right, quarantine app, it may make sense for them, right, to ask for the GPS location, right? But if the app is talking about only like contact tracing, right, it may not make sense, right? So I think this is something we should keep in the consideration as well, that like what kind of purposes this app like trying to do. And there's a possibility that like one app, right, maybe it starts small and then later it growing bigger and bigger with more functionality, with more purposes got combined into the single app, right? So the assessment that may sound right? Or in the first place may change later. So I think that's the thing as well, because like a lot of times we have to keep in mind as well that like a lot of people actually allow apps in their phone to auto update, to update automatically, right? And this can actually change the functionality or purpose of the app without the knowledge of the users. That can be possible as well. And then we're talking about tracing model, right? And I think Kali also like cover a lot of this already. But also there's also the question as well, like who in the end will able to see this data and for what purposes, right? For example, in many cases, people, there's a tendency that feels like, okay, there can be a second wave, right, of COVID-19, right? So maybe we should keep the data a little bit longer, right? Just in case it can be useful in the future, right? And how to deal with that situation, right? If we use the rationale of public health, it may sound acceptable, right? Because it can be benefit in maybe in the next wave of infection, right? But like from the privacy protection perspective, right? In terms of like the declare proposed or the consent, for example, it may not really along that line, because like in the first place, when you ask people to install the app, you're only talking about this wave of pandemic and not the next wave of pandemic, right? So I think that kind of tricky as well, should be considered about. I think we can go on and on about this, right? But I think those links, right, actually give a lot of example. We can discuss later about this, right? But the last point I like to make here is like the social graph of this. So I think like this is something that like very interesting, at least for me, because in the end, if there's a way that you can actually identify, right? Or maybe by maybe like the system it's really well designed, right? But there probably maybe like unintentional mistakes, whatever. And in the end, like a bunch of people can be identified through this kind of data, right? And in the end, you can see the patterns, right, from these like exposures, like and or like contact tracing thing, right? You can know kind of like behavior, like okay, this person tend to meet this person at this time or at this frequency around this location or whatever, right? Or not necessarily the location, just only like person to person. For example, I just give you an example, right? Don't not thinking about at all about the contact tracing, just like normal telephone, right? The patterns of like I calling to someone, right? Only from Monday to Friday, right? During the working hours, during the day, right? And the patterns I call to another person, and most of the time I call this person Friday and Saturday after 5 p.m. right? This kind of thing, right? These two example, maybe you probably don't know like who are they, but you can guess somehow my relationship with these two persons, right? The first relationship is with the first person is probably kind of like a work relationship, right? And for my relationship with another person, I often call like on Friday and Saturday after hours, right? After working hours, maybe it's like friends, something like that, right? So contact tracing app has a potential to actually create this kind of social graph, right? And the thing is that like we as a human, as a social like a person, these kind of data not change very fast. So the location, for example, can be changed very fast, right? I mean, you move from one place to another place, right? And then probably you change your office, you change your accommodation, right? But you so maybe the cycle is maybe like 2 years, 4 years, things like that. Like when you're moving from one city to one city, or one accommodation to another accommodation, or the shops that you often go, right? But the cycle that you change the relationship with your friends and family, it's longer than that. So is this actually possible to actually, like, within the span of like maybe 2 months, right? You already have enough information to draw this social graph to use with this particular person, right? And his or her networks, right? For maybe 10 years, right? So how to actually, like, like, I don't know, like how be more be careful about this, because like in the end, when you talk to social graph, it's not only about the we were talking privacy violation. It's not only about like one single person, right? It's the whole network that related to this person, right? If you in the end being able to create this social graph in a very short span of the pandemic, right? But then you can actually use this same data for a very long time, because the relationship between human and human doesn't change that fast.
Thank you,
I
Art.
think we can discuss more later. Yeah.
Thanks very much. And we'll probably come up a little bit more with that later on. And basically, you're saying that the app can track information about COVID, but also it tells us a lot more else about who we are and who we might be meeting, and that might be retained longer. Yeah, I'm going to head over now to Rob Kitchen, who's professor in the Youth University Social Science Institute in Ireland. He has conducted extensive research on digital technologies and their impact on society. He's the co-author and author, co-editor and editor of over 30 academic books and a couple of 100 articles and book chapters. He's a recipient of the Royal Irish Academy's Gold Medal for Social Scientists, and his most recent article is Civil Liberties or Public Health, or Civil Liberties and Public Health, using surveillance technologies to tackle the spread of COVID-19, published in Space and Polity. And I'm sure he's going to give us a synopsis of some of the issues he's raised in that article now. Over to you, Rob.
Right, okay, thanks. Thanks a lot. So I want to kind of widen the conversation a little bit and talk about the contact tracing in the context of a suite of different surveillance technologies that are being used, and that are kind of suggested a range of different apps. So we have information apps, quarantine apps, various forms of smartphone apps. But there's a range of other technologies that are being used. And then I want to kind of expand that into what does that kind of mean for civil liberties and a kind of a new normal in terms of a surveillance regime and so on. So there's a range of different technologies here being used to think about tracking a location and movement. So it's about the spread of the disease and how it passes from one person to another. And all the technologies in the kind of top left box there are now being rolled out and used. So there's been looking at things like facial recognition cameras and thermal cameras, testing for people's temperature to see whether they have a fever, being able to recognize faces and see whether faces are close, people have been near to each other and so on. Things around like biometrical wearables. So like in Hong Kong, if you land in the airport, they give you a bracelet, and the bracelet tracks your movement and so on. In Liechtenstein, they're looking at biometric bracelets that would measure kind of core health vital signs to see whether you might have symptoms and so on. Places like Dubai and other places, Italy, they've been trialing these smart helmets. So kind of using like AR, augmented reality technology, where you can kind of see people's temperature through looking through the visor. So it's a kind of the camera, the thermal camera is built into the helmet. Using things like drones to monitor the patterns of people moving within particular spaces. Again, in Italy, they were using drones to see how people were congregating in the city, or maybe breaking the lockdown. And again, they in some cases had thermal cameras mounted on drones and so on. And then using things like predictive analytics to maybe take some of this data and run analytics on it to look at whether patterns of social distancing, patterns of flow movements of people moving from one place to another place, and so on. And so those kinds of technologies are used then for a range of different measures. So we talked about contact tracing. There could be quarantine enforcement, so to make sure you don't leave the home. So for example, in Taiwan, they basically had a geofence on your smartphone. So if you went more than 100 meters from your home, it would alert the authorities, and you would get the police would come and see you with quite significant fines up to $35,000 if you broke that. And they basically gave phones to people who didn't have phones. Travel permission, so you basically apply to be able to move. So this is happening in places like Moscow. You apply and you get permission. You get permission for a particular route, and then you have to kind of scan QR codes as you move around. For looking at things like social distancing, movement monitoring, and things like symptom tracking. So you self-report your symptoms, and you can then, this is more kind of maybe information that's going into modeling teams to kind of have a look where there might be hotspots developing, and so on. Now, all of those kind of technologies raise a whole series of kind of ethical questions concerning their deployment, because they're all about monitoring health, our movement, our social contacts, and so on. And there have been kind of arguments kind of saying, look, we need to park civil liberties because public health comes first, and then a whole bunch of pushback by people kind of saying, no, these are not mutually exclusive. We need to find ways to have civil liberties and public health. And that's been a lot of the debate in contact tracing. It's like, can we have both situations, you know? So I'm trying to argue that they're not mutually exclusive, and the details of the paper where I talk about this are there. So you can move to the next slide, please. By the way, thank you. So Art and Kylie have really done on the left-hand column of this slide. So the kind of technical, practical things, and I try to set this in a little bit of a kind of ethics context. So on the left-hand side, which I'm not going to talk about, is kind of an ethics of how the tech actually works in a practical sense. And then the other two, like the civil liberties and citizenship and surveillance capitalism, are kind of an ethics of what the tech does, and a kind of an ethic of what the tech facilitates. And so these kind of technologies raise a whole series of questions around individual rights versus public good. They raise a whole series of questions around privacy. And the contact tracing has really focused a lot on privacy. Personally, I think the bigger issue is really around governmentality and around citizenship and around the surveillance regime that this brings in, as opposed to privacy per se. So you know, issues around kind of governmentality and around the way in which we kind of govern society and manage how people can move, interact, and so on, and their kind of health. So these are all about shaping who can go where, who can go when, how they can get there, what they should be wearing, how they should act, and so on. So there could be quite explicit social and spatial sorting going on here in terms of, you know, and this has been going on in Ireland with lockdowns about who can travel more distance, who can go on what modes of transport, all that kind of stuff. And it can act into redlining and so on. Some of the data, not necessarily from the contact tracing, but certainly some of the other data where you might be using mobile phone data to look at move flow. So some of these other technologies, like people like some of the big mobile phone companies or some of the location marketing companies are sharing their data with government to look at flow modeling. So you can do population profiling off of that. So some of our data related to our phone, whether we give permission or not, is actually going into modeling around some of this, what's happening. Things like control creep. So control creep is the idea of a technology developed for one purpose moving into a different purpose. So that could be a smartphone moving into doing contact tracing. It wasn't designed to do contact tracing, but we can make it do that. But we can also have an effect afterwards, which is we have a phone that's used for contact tracing and for monitoring people's movement and social network for public health, then being repurposed to do it for issues of security or issues for policing or issues of something else afterwards. So the technology gets developed for one purpose, it gets repurposed for something else, so the kind of control creeps across into a different domain. And that's the real issue with some of this tech, because it normalizes the tech and it normalizes how we use the technology, and we get used to that, and then it can get repurposed into other into other forms. And that can kind of, in kind of authoritarian regimes, it provides a much kind of a big brother, more deeper kind of surveillance kind of grid. And that's happening in some countries. So the quarantine permission app in China that was just meant to be rolled out for COVID, they've already announced in some provinces that will stay in place afterwards. So the scanning of QR codes to get access into certain places based on health or based on other, it might shift into other kinds of security concerns, will stay in place. It's not going to be rolled back. So if we normalize this and we let it roll out, will we be able to undo the kind of surveillance that we put in place? And then there are other kinds of questions then around due process, around oversight. Like we're making decisions about whether people can and can't work, whether they can and can't travel, whether they can and can't see family, and so on. And if we're making incorrect decisions, is there a way of challenging that? Is there a way of making sure that things are working properly? Is there mechanisms of redress, and so on? And people are quite nervous of that because of state records around things like data valence. So Snowden, WikiLeaks, you can kind of name your scandal, Cambridge Analytica, and so on. We kind of know that the record around some of this stuff is not great. We know that some of the technology we put in place after 9/11, the kind of control creeps at that point, has not been rolled back. It became part of a new normal. And there might be kind of public trust and chilling effects, and we can see that already in terms of things like the download rates on contract apps in other countries. So in Singapore, it was less than 20%. In France, it's actually really quite low. I think about 1.8 million people downloaded the app in France. About 450,000 people have uninstalled it out of a population of 67 million. So, people have not trusted the technology. And then there's a kind of this ethics of what the tech facilitates. So there's been quite a lot of pushback against data brokers and around kind of surveillance capitalism, but actually adopting this technology and using it this way basically legitimates surveillance capitalism, and it legitimates like Google and Apple's ability, if we're using their API, to kind of use that technology to track and trace people. We kind of legitimate that. We're potentially creating new market opportunities into health data, but also into kind of surveillance. And there has been a kind of a push to kind of normalize, for example, facial recognition data, data broker data, location-based data into this period. And it's quite clear that the NHS, for example, in the UK, has a whole series of different relationships with private companies now doing their data, and then other issues around what happens to that data. So there is a sense in which there's kind of a deepening of data shadows about us. If you need a smartphone for this to work, then there is this kind of enrollment of new smartphone owners, and then the enrollment of those people into those data shadows. So there's a kind of a push along that lines. And there is a sense in which there's a kind of a COVID washing of activity. So things that we initially thought were really problematic now becomes the new normal, and companies can kind of use COVID as a way of kind of washing activities to kind of say, well, look, this is good for society, even though there's a series of other problematic issues in behind that. And obviously people are making a lot of money on the basis of this, and some companies' share prices have gone up and through the roof on the back of some of this technology. So this is all about kind of a normative notion of what kind of society we want to live in, normative conditions around how we want to govern society, and around citizenship, and about what rights and entitlements, and the effect of which we will, there are sunset clauses, and that this tech will be rolled back afterwards. So once the pandemic is over, does this tech get rolled back and disappear, or does it become part of a new normal kind of set of surveillance? And this is not just within the kind of open society. This will become part of workplace practices. So already workplaces are starting to talk about having registers of who comes into buildings, who's in classrooms, who's in different spaces. So pubs, and for example, being asked to or restaurants asked to keep a log of who's come in, and so on. So it has an effect onto workers as well, a new kind of workplace surveillance potentially coming in. Okay, I'll leave it there, and we can move on to talk more specifically about the Irish case.
Thanks very much, Rob. And our final speaker is Elizabeth Farris, who's the Director of Information Rights to the Irish Council of Civil Liberties. She's joined experts to publish open transparency calls and principles regarding Ireland's proposed COVID-19 app. She publishes, advises and advocates on the intersection of tech and human rights. Elizabeth's going to talk in particular about the Irish situation in terms of the app. Over to you, Elizabeth.
Hi, thanks, Aline. And thanks to Digital Repository Ireland and to Coffee Circumvention for bringing our group together tonight. I'm really pleased to have joined this conversation on behalf of the Irish Council for Civil Liberties at what's proving to be a really key moment for the COVID-19 app in Ireland. What I'll do for my part of the talk is I'll take the helpful conversations from Carly, from Art and Rob, which have provided a really helpful and broad overview about the tech at play, the social implications, and the civil liberties at stake. And I'll narrow that discussion to Ireland specifically, where, as we all know, an app has been developed by the Department of Health, Ireland Health Services, HSC, and their private and governmental partners. And I'll then discuss the questions being asked locally about the Irish COVID Tracker app. Some expert initiatives ICCL has joined, calling for transparency and a principled framework, and then I'll outline where we are today with the app. So questions in Ireland that are being asked about the app include whether the app is actually the right tool for a public health response to COVID-19. Will the app work here? Will it stay within the confines of its stated purpose? Will it comply with human rights norms and the law? And today we still don't have really strong answers to those questions. What we do know, what the public knows about the app today, is that the government has engaged Google and Apple to explore contact tracing. However, the app is not simply contact tracing alone. It will include a symptom tracker, which may have location tracking capabilities attached to it. And it will also be, and I quote, a trusted source of information during COVID-19, which will apparently seek to compile personal data statistics, including details which may be as wide-ranging as geographical location, but also one's gender. So an app that processes highly sensitive personal data, including health statistics, triggers what we would call concerns amongst rights experts in Ireland. Ireland has a specific history of personal data processing tech projects gone very, very wrong. And I think COVID-19 management has thus presented an opportunity to learn lessons from past mistakes so that we don't repeat them here. And I would say avoiding past mistakes will include avoiding what Digital Rights Ireland has warned about the risk of an app morphing beyond its original intended function into what Digital Rights Ireland called a super app. And I would say that concerns about a super app were valid. We've seen these changing purposes in other parts of the world where apps which were once voluntary and contact tracing based alone morphed into information harvesting apps, which were mandatory to leave the house to attend work. Carly mentioned needing the app to work in India, but in India, it's now also been made mandatory for bail conditions. You need to download the app in order to get out of jail. I don't think we want to replicate in Ireland the issues Rob has described in China. And so this function creep away from purely health-based initiatives into super tools of surveillance, that's a concern that doesn't just occur in autocratic societies. We need to be really mindful of this concern in Ireland, where we have seen the emergence of excessive surveillance examples in recent years. We're seeing drones at vacation spots. We're seeing proposals for facial recognition technology in children's hospitals, in schools. We're seeing the use of facial recognition technology so people can access social welfare services to which they're already legally entitled. And this is why an understanding of what's happening with Ireland's COVID app and absolute transparency is a really essential first step to ensure democratic solutions to the pandemic crisis occur. So what happened in Ireland is that a group of experts joined together in April, asking the Irish government for just that, for clear transparency. And our group is composed of academics from most universities in Ireland, from computer scientists, from data protection experts and organizations, and from civil society groups, including the Irish Council for Civil Liberties. And what I'll do, if I may, is I'll just share in the chat box here the open letter we wrote back in April asking that the HSE publish the app's draft specifications, the data protection impact assessment, the source code, and also that they allow space following the publication of this information for input from experts and for public scrutiny of what is proposed. And I want to be really clear, explicit transparency is not a big ask in a democratic society. It's really essential to ensure our government acts in a constrained and rights-respecting way. Was our expert call for transparency answered? Well, no, I mean, not exactly, and certainly not yet. But we have learned today that the data protection impact assessment is being released tomorrow, that it's being released with the source code. And I'll say a bit more on that shortly. But while we were waiting for a response to our transparency call in April, most of our experts groups joined together again to build a principled framework. And if you go to the slide here, you'll see that in on June 3rd, we launched 9 principles for legislators developing surveillance technology in response to COVID. And what I'll do is I'll just share the link. I should find the link to the ICL website to share that too in the chat box. Actually, you can see the link at the bottom of the framework there. We have a more comprehensive outline of the principles at the ICCL, however. So the principles don't encourage the development of an app. Rather, these principles reflect our experts' call for best practices if a government decides to deploy an app. Our principles cite recommendations from the European Data Protection Board and also the Ada Lovelace Institute, which Carly is kindly here with us tonight as the executive director. And they serve to provide a framework for considering whether a COVID app is actually the right solution for Ireland. And if so, if it is the right solution, the principles provide guidance around how to do it right. So you'll see in our principles that the app must have a clear, limited purpose. It can't morph into those super apps that we're seeing elsewhere. The app needs to be necessary and it needs to be proportionate. If an app starts to invade into the protected space, to encroach into the protected space that is our privacy, for that to be a proportionate encroachment, the app needs to be effective. It needs to work. And so so the efficacy point is important here. And I would again say, like, why are we going to do it if it's not going to work? Now, Carly and Art have raised important questions about whether these apps are actually going to work well. And we have research from Ireland specifically by members of our expert signatory group. We've got Doug Leith and Stephen Farrell, who have similarly suggested, based on their research in Ireland, that the tech itself may not actually be that effective. In May, they published a study on the Singaporean app model and discovered, as was described in this talk, that the Bluetooth model, which, the Singaporean model really kicked off the global interest in the COVID apps in the first place. It identified serious problems. The model doesn't work that well. The signal strength is too variable. But our expert scientists didn't stop there. In June 15, they moved from looking at Bluetooth generally, and they moved to looking at the Google Apple system. And they warned that there would be false negatives, which may be unavoidable using that system without significant calibration. These false negatives are when you encounter someone who has COVID-19, but you don't get that notification. And then in 15th June, they did a study on a bus. They took the Google Apple system onto a bus and found that the system doesn't work very well within a bus. They'll be publishing results for the Lewis soon. I don't think the results will look positive there either. So regarding efficacy of the COVID app in Ireland, the results from independent scientists don't look encouraging. Now, the Department of Health has a different position on this, however. ICCL was fortunate to meet last week with the Minister of Health and his team. And I want to say that it's a credit to them for meeting ICCL. It's a principle within our slides framework. I think it's the last principle, that government needs to broaden the range of actors involved in developing and deploying tech. And the Minister of Health has done this insofar as they've met with us. And actually, if you go to the next slide, I'm sorry about the quality. You can see the various experts who have joined this initiative and who have signed on. But so during last week's meeting with the ICCL, the minister advised us that the app development is complete. And they are pleased to say that despite all this other research we're seeing in Ireland, that their app actually works. And they gave an accuracy figure of 72% and a false positive figure of 13%. On data protection and privacy concerns, they told us that they sent their data protection impact assessment to the Data Protection Commissioner, and the DPC took considerable time to go through it and sent back a 20-page reply with enormous detail. And the colleagues working with the Department of Health, we're told, are now currently implementing the recommendations of the DPC. We understand that the Department of Health have been working with the following private companies. They're working with Nearform, they're working with Testis, they're working with Explio, ISAS, and EdgeScan. And we learned that the cost of developing the app is around, the budget for the cost of developing the app is 750,000 euros, and it will cost 350,000 euros a year to operate. So the minister's engagement with civil society and our expert framework has been strong on this. But despite their engagement, we're still concerned. We're concerned that the app isn't going to work, not only for the sociological reasons or the minimal threshold uptake, which others have identified tonight in this talk, but also for the technical barriers which have been identified by our panelists, but also by scientists in Ireland. So ICCL has written to the Minister of Health saying that it would be really helpful if they could further explain with more detail the accuracy of the false positive figures. How did they arrive at a figure of 72%? Why did they determine that level of efficacy when our independent scientists are seeing starkly different results? Also, is 72% a great number if people are going to be asked to self-isolate and to miss work on the basis of the app? Similarly, is the 13% false positive rate going to have negative outcomes? We're also concerned that this is going to be an expensive project propelled by cooperation. I should say I am concerned that this might be an expensive project propelled by cooperation with private and profit-oriented companies. Why are we continuing to develop an app with a lower efficacy rate if it's not the best solution? And just regarding the risk to our privacy and to our personal data, it would be really nice to see what exactly the Data Protection Commissioner said in her 20-page reply about the app and how those comments have been responded to specifically. It would be great not only to see these apps details that are being released tomorrow, but also to have an opportunity to review and discuss well in advance of the app's launch. So that was a really fast overview of the situation in Ireland regarding the HSE COVID app. We really appreciate the Minister of Health meeting together with their team, meeting in good faith with ICCL and others to discuss these matters. However, we do still have unresolved concerns regarding efficacy, regarding rights and transparency. And so I'd like to conclude by quoting the Executive Director of Privacy International, Gus Hossain, who during a talk on this matter a couple of weeks ago said, "If governments are talking about apps, then governments are doing it wrong." And I'm not unsympathetic to that perspective. Building tech to answer social problems, including health emergencies during pandemics, can be a very ideological charged form of solutionism, which can be driven forward by profit-oriented interests, and which can leave important concerns about rights and the law behind in the dust. And so our expert group has provided really strong guidelines based on leading principles, which say that if you are going to do this, we're not sure if you need to, but if you're going to, here's how to do it right. And in terms of the COVID app in Ireland, we're looking forward to learning more, and time will tell at this stage. That's me.
Thank you very much. Okay, so what I'm going to do now is I'm going to open the panel up and maybe take some questions from the audience. Some of the questions are coming in. So maybe I'll take a couple of questions, and then also if some of the panel want to ask each of the questions, feel free to do so. So let me have a look at what we have. So some of the questions are about the technology involved. So we've got a couple of people who are interested in asking you about the use of Bluetooth. So this is from Lydia Flynn. So she says, the public discourse relating to the centralization-decentralization issue has focused on governmental misuse, but there's another source of risk, malicious non-government actors. Given that Bluetooth is widely regarded as insecure and that user awareness for commercial purposes, does the panel think that the public is being unduly assured on privacy issues? Given the overall risk to the end user, are Bluetooth-based contact tracing apps being misrepresented as pro-privacy? For example, there was a significant vulnerability found in the Australian app. And Alan Bell also says that Bluetooth seems to be a poor technology to detect meaningful interactions where the virus may be passed, but it does have the advantage of being hands-free and automatic. So what do people feel about the use of Bluetooth in the technology?
I think a lot of those concerns are right. You know, the technology does seem to have issues over the sensitivity of the ability to detect closeness, for example, and you know, whether there's a wall or a glass in the way. If the phone is in your pocket or in a bag, that will dampen the signal, and so on. So there's issues around just getting the notion that you're within close proximity, the 2 meter kind of position. There is a thing around the time. So I don't think we said that, but normally it's with, rather than just every phone being near to each other, because otherwise you'd get millions of contacts, right? It's your phone is near another phone for 15 minutes. So there's a kind of a time element built into these apps. I think in the UK it's 15 minutes. I expect the Irish one will be 15 minutes. So that's an issue if people are going to be moving around, and you could have a very significant thing like passing somebody in a supermarket and they sneeze on you. That would be significant, but it wouldn't be registered in the phone and so on. So there's issues around that. And I think there's going to be a lot of work done now as more of these apps are released in different countries, of people looking at the efficacy and whether they do work. But the initial indication is that they don't, and partly to do with the take-up rate. Like if you need 60% of people and 80% of phone users to make this work, you know, if only 20% of people have got it, you know, there's only like a 4 or 5% chance that 2 people have both got it on their phone when they meet each other. So that's a really low potential contact. And on some of the countries, we're seeing that there's been very low numbers of data actually coming out of this. So I mentioned France, you know, there's 1.8 million downloaded, 466,000 people have uninstalled it. Only 68 people have reported that they've tested positive. And I think the phone has only alerted 14 people. Now that's not a lot. In Australia, there's 6.2 million downloads. The data has only been accessed in relation to 30 cases, and it hasn't identified a single other positive case of the contacts. So now that's partly to do with this low number of cases. So if you, in a population, you've got a very low number of cases, you expect a very low number of contacts. But even so, it doesn't seem that the technology is really picking up the contacts. Now, there are only a couple of cases, and I expect there'll be a lot more on that. But we've kind of rushed into this expecting that it will work, but we actually don't know. And there are efficacy questions there. And so we might actually be kind of eroding away our privacy for something that doesn't actually function as it should do. And there really does need to be a lot of testing done on this. And some of the testing out, things like the Isle of Wight study in the UK, kind of suggested it's not really going to work there for different reasons, because of critical conditions around take-up, but also actually whether the technology is sensitive enough to do what it's meant to do. And we simply don't know. That's part of the problem.
I wanted to add one point here
pick up on that
as well. Sorry. Okay, I'll go. So yeah, actually, like there's a vulnerability, right? Here as well for Bluetooth. But I think like there's two separated parts, points here, right? The first part is like the weakness, right? Or the risks in the Bluetooth technology itself. the protocol itself, right? And the second part is more like how this Bluetooth technology has been used or implemented in the app. And I think like and both like actually like if it went wrong, it go wrong, right? It's not good for anyone anyway, right? But I think if it's the case that like it's about the implementation part, right? It's like how you like design or like do the coding, do some programming, right? And you actually did some mistakes. I think there's a pressure here as well, which like how to say, like I think like a lot of countries are in the rush, right? I'm not saying like I'm do the how to say, like defend for these people, right? But like it's kind of like understandable, right? But not acceptable, right? That like why this thing happens, right? So in a lot of cases, when you making a software, right, you have to go through the state of like testing, right? The software, where it's actually work as intended or not, right? And there's like different stage of like doing this like software testing. We found that in a lot of countries, government, right, or whoever like that, like implementing this are in the rush, right, in under pressure, and they just launch it, right? So basically, right, in a lot of cases, the public has been used as a test bed, right? And then later, when they found it, they fix it. But the data that has been leaked is already there. So I think that's one of the issue as well, that like whether we actually like, if in the end we like to use these kind of apps, right? The resources is not only about to develop and design the app. It's all, the effort should be also like put there to actually test the app within like a sandbox that's like not in the public, right? I think the situation that we see now in a lot of countries is basically like they just test it in the public, right? So I think that's one of the issues as well.
Yeah, I think by doing it quickly, the danger is you lose public trust. So that was one of the things in the statement that we made was do it right first, because if you do it badly and it goes wrong, then you'll lose trust. And in other places they have done that, right? So Lithuania had a kind of a cease and desist order on theirs yesterday. You know, so some countries have failed on their kind of data protection. So Lithuania, Norway, Israel, there's all been court cases, or the data protection commissioner has told them that they have to go back and fix things. If you have to go back and fix things, you lose public trust. You lose public trust, that's a chilling effect on public health. So you want to get it right first time round. I think there was a question around if you're opening up the phone to Bluetooth, you're actually opening up to other things, and I think that's true, right? So if my phone is pretty much locked down, right? I don't have the location on and I don't have Bluetooth on. But if I have to turn Bluetooth on and I have to turn location on for this app, then I potentially open that data up to other apps on my phone and to other phones that are near my phone. So the threat might not come from the contact tracing app itself, but might come from the fact that I've opened my phone for other apps to start harvesting data off of my phone. I also open up to kind of spoofing and duping and other kinds of things, right? Because people can kind of capture my Bluetooth signal and, you know, take it off and broadcast it somewhere else if they really want me to have to stay at home or something, you know. So there are kind of issues around if you open up the phone for the contact tracing, you potentially open up the phone for other things. And so that I think one of the questions was kind of highlighting that a bit, and I'd agree there are potentially risks. There's potentially risks there.
I have another question about the effectiveness of the app in terms of doing what it's trying to do, being an effective public health intervention. Andrew Flood asked Elizabeth, he just wants to check, did you say that the 72% accuracy figure is a false negative figure, and 13, which means that 13% is false positive? So does that mean that 13% leads to action in terms of the isolation prior to testing?
Hi, thanks for that question, Andrew. I was rushing through some information. The information that we have from the Department of Health is the app is 72% accurate. And then 13% of the time there's a a false flag. Did I say false positive or false negative? I'll have to find that exact point. But here is what we do know. We know that the Department of Health is confident that it's 72% accurate. That number is really unclear. That number isn't backed by any data that has been published at this stage. And that number wasn't provided with any sort of statistical rigor in the very brief meeting that we had with the Department of Health last week. That's why we've written to the Department of Health and asked for those numbers to be broken down further. I think an efficacy rate of 72% seems very optimistic in light of findings from other scientists. And I'd like to see why it's different in Ireland, why that number is higher. And I'd also like to consider, even though that number of that 72% accuracy rate is higher, is that good enough in light of all the other considerations that move towards having an app work really well? Is 72% enough if the other percentage where it doesn't work or where there's the false flagging means that people miss work or miss an opportunity to socialize because of that inaccuracy? So those are questions that need to be further examined and debated before an app is pushed out into the population.
I'd add to that, like, that I think you're dead right that the false positive has potentially big consequences for people. And
I just want to be clear, it is false positives. So they said 72% accuracy and 13% false positive rate. We don't have a figure for false negatives. Those are the only two figures we got from the Department of Health. Sorry, go on, Rob.
Yeah, so I mean, the false positive, like that, if we have a second wave, for example, that's keeping first responders out of hospitals, it's keeping people away from work, it's keeping people away from family, from socializing, from, you know, mental health. There's all kinds of issues around a big false positive rate, you know. I do think there's an issue around the critical conditions, you know, so we do need a large number of people to use it, and we do need effective testing. So this should be based on testing, right? The mantra is test, trace, and isolate. It's not trace and isolate, right? There has to be testing. So what this should do is flag up that you go and get tested, not that you go and have 2 weeks isolation. You isolate until you've been tested and you've got the result back. But you're still going to put a lot of pressure, potentially over the 13% false positive rate of, you know, now maybe that's an acceptable rate, and we need as a society to decide, yeah, that's an acceptable rate, and we're going to take that because the consequences are, you know, people being very ill, some people dying, and so on, and maybe we need to do that. But we do need to actually have the public debate around what we think are the acceptable parameters around this. And without the publication, without testing of the app and this kind of information around the accuracy rate and the false positive rate, and without the DPIA and without the code, we can't make those informed decisions, you know. So that's why it's really important that comes out, and that there is a gap to be able to respond, that we don't get the DPIA and the app is released 2 hours later, you know. So
there were a number of people asked about that issue about transparency. David Hunt said, so Elizabeth, you mentioned that the source code has been released. Does that mean the app will be open source? He said that technical and security review of the app's code will help address a lot of people's concerns of what it's doing in the background where data is being stored. And Alan Bell asked the same thing: will the app be open source and have a defined protocol for service interactions? Would it be possible for people to write other apps that talk with the same protocol?
That's a really interesting, and I would say a very important question. Whether or not the app would be open sourced was a question that was posed to a person from the Department of Health in the Dáil this morning. That representative responded that they didn't understand the question. Not understanding the question raises certain concerns for me. What we did learn in the Dáil this morning is that the source code will be released, that it will be released as soon as tomorrow, which will give experts within our expert group a time to review it and to raise considerations. As Rob said, though, we need the data protection impact assessment and the source code and the other details that we've requested to be released with sufficient time to allow for experts to review and engage. And we need for the Department of Health and involved partners to be responsive to our engagement. Transparency isn't sufficient if it's simply, you know, here's some information and now we're just going to go ahead and do this anyway. There needs to be a democratic process in between the release of the information and the launch of an app if Ireland decides collectively that that's the best step forward.
To add on this, like open source.
Art, can I let Carly in because she had another chance to speak?
Sorry, I just wanted to come back in on the efficacy point just really quickly, because I hadn't heard that 72% figure, but I just want to be really clear what that actually means, which is that means it's effective in 72% of the time in detecting when a phone is near another phone. That's not the same thing as effectively detecting like passing on of the virus, obviously. And it may be that actually it's effective a much smaller percentage of the time in actually detecting contacts in which the virus is passed on. So for example, if I walk into a shop and I touch a bunch of things and then I leave and someone comes in 2 hours later and touches those same things and catches the virus that way, the phone won't detect that. Or if I'm standing 5 meters away from somebody, but they're standing with their back to an air conditioner and they cough in my direction, and the air conditioner carries the virus that way, which has been in some tests known to happen, that the app won't detect that contact. So I think it's really important to just know even a claim like 72% efficacy needs to be looked at through that lens, which is what are they saying is effective and what isn't captured by that. Sorry if you've already covered that. I was stepped out for a few minutes.
We haven't, and that's a really important point, Carly. It's great to have that clarified. We needed a lot more details on that very brief figure that they gave to us in terms of what Ireland means when they say 62% efficacy.
Are there any countries that have developed apps that you think are best practice in terms of balancing public health and privacy that you can say that's a good model to follow?
It's a tough one because I think the countries that have had more successful responses to COVID generally have not been relying on these types of apps as central to their COVID response. So you might look at places like New Zealand, for example, very successful response, no use of an app. Australia has rolled out an app, quite widespread uptake in contrast to other countries. I think somewhere between 20 and 40% of the population downloaded the app. I think it's been successful in detecting one transmission of the virus in the whole country. So again, not critical to their successful response to the virus more generally. And even in East Asian countries like Singapore, South Korea, Taiwan, who have also had successful responses to COVID, and some of those have some types of apps, the people involved have said it's not the contact tracing app which is central to their effective response at all. It's a range of other highly interventionist measures, some of which are worse for privacy, it's important to say. So in South Korea, for example, you have text messages going out to whole neighborhoods saying, watch out for this person in your neighborhood, they have COVID. And, you know, that's a separate discussion about, and Rob touched on some of these types of measures in terms of privacy intrusion. But just from the perspective of contact tracing apps, there's no evidence from any country where it's been a kind of decisive factor in an effective response to the virus.
We've only 10 minutes left. So I have a final question before I bring that to you. Do any of the panelists want to address something that maybe one of the other speakers said?
Just on the point of like open sourcing the code, right? I think it's not only about the product itself. So when you're talking open source, it's actually about the process, right? So actually, it's actually very, very possible, right? That like you actually, okay, here's a source code, right? You put on GitHub or wherever, right? The public repository. But the actual app that you send to the app store may be a different one, right? So actually how you can know that, right? So I think like the thing that I think it should be more transparent is that like, okay, how the code that you open to the public, right? And probably make change. Maybe people like file a bug, make suggestion, right? And there's a change. How this change will reflect, right? Into the app store. I think like this kind of process, right, should be transparent as well. Only the code itself as a product, right? Because when talking about the open source, it's about the process as well, and this should be transparent as well.
I think Natalie has a question there around, you know, what the fears are and what the concerns are and so on. And I mean, a lot of those got expressed quite early on, I think, and that's why there was so much pivoting going on, that people were moving away from the centralized app and so on. I mean, in the UK, for example, they were talking about the data would be around for 10 years and that they would use it for research purposes, and you know, and the real questions there around what would happen to the data and how it might leak out, because there's a whole bunch of questionable actors involved in the UK's data health system, people like Palantir and faculty and so on, and so there were kind of concerns there. So the shift onto the Apple Google platform, I think, was in reaction to people pushing back against some of those concerns. So a lot of those have started to be addressed. And I think, you know, the kind of the move on to you know, the decentralized model and taking on board things like the European Data Protection Board's recommendations and so on. So as time has evolved, I think the concerns are kind of shifted a bit because the technology shifted a bit. But that just shows us, like, some of the problems Art was kind of saying before, of this kind of rushed nature of this technological development, where you've got this movable beast going along and so on. I mean, I would be, my kind of concern in some senses, I really think it's a mistake to use self-diagnosis data, for example. I think it has to use tested data. I think there'd just be too many false positives using that kind of stuff. And I think it's a mistake to have a symptom tracker embedded in with a contact tracing thing. They're two separate technologies, and I think they should be separated. I think that's a mistake to have them together and so on. So I think they should be a limited purpose, and I think the shift of saying things like the data will only be held for 14 days and then it will be deleted, that's been a positive thing, rather than the data will be kept for research purposes and might last for ages. I mean, basically what was happening was different people were wanting different things out of the app. So people on the modeling team want the symptom tracking data because they want to be able to see where possible new clusters of infection rates will come. And that got folded in. So you have a kind of a round robin within the HSE of different constituent groups in there and what they would like to get from the data. And then it's kind of been rolled back and pushed back as people have been kind of saying, well, you know, we need to kind of separate these off a bit and we need to have limited purpose. We need to get the kind of things the ICCL was saying, and people at the European Data Protection Board were saying, and people like the Ada Lovelace Foundation, in the US EF, the Electronic Frontier Foundation, and the ACLU, and so on. So a whole bunch of organisations have been kind of trying to corral this back and put limitation on. But I do think we'd have to be really strong on things like sunset clauses and about rolling back and about not normalising this new wave of tech, and that's going to be a big challenge as this stuff kind of keeps moving on, because this pandemic is not going to end in the next 2 or 3 months. This is going to go on for a while, and we'll be living with this tech for a couple of years probably. And so it's important to get it right, because as I said before, if we lose the trust, then the chilling effect will be huge.
So then the last question is an obvious one. It's from Liz Carroll, and I'd like to know the answer myself as well, which is, on balance, would you download the app yourselves?
I'd only download.
Yeah. I'd
only download it. At the minute, I download it out of pure curiosity, right? But if I was in seriousness in terms of using it and so on, I want to see the DPIA. I want expert opinion on it. I want somebody to test it. I want independent testing of the app and so on. And I want reassurance that I can trust it on the basis of the kind of 8 or 9 conditions that the ICCL has said. And until they've got that, then, you know, I'd be cautious about it.
What about the rest of you? Elizabeth?
Yeah, I would not download the app right now beyond sort of for the research purpose that Rob described, until we get answers to our clear call for transparency from our expert group, and until we have an indication that our principled framework, our 9 principles, are being adhered to. There are just too many unknowns at this stage. I'd be downloading it in the dark, and that's not something I'm interested in doing right now.
Art, what do you think?
I will download it in my second phone. and see. Out of curiosity, I just want to like see like how it works. Like, but like asking me whether I'm going to like turn it on and walking around in the public on regular basis with that. I think like I'll probably take reservation first, and then after I feel like okay, I can confident with this. Yeah, I feel like yeah. If I can trust right the system, right, I feel like yeah, maybe why not? If I can contribute something to the public health, right? But that's of course like not on day one, right? I probably need some time.
And Carly?
It's a really good question, Liz. I think something I've been thinking a lot about also as friends and family ask me, should I download this? I would download it if I heard public health people say this is really important for the work we want to do, and I still don't hear that. But even then, I wonder what I'd do when I start receiving the notifications. Knowing how valuable it is, I may download it, but I could equally see myself thinking, I'm not so sure that that person really has COVID, or I'm not so sure my phone correctly judged the distance between me and my neighbor when I was speaking to them over the garden wall. And I think that that goes to the heart of the problem, which is this is not only a technical challenge, it's a behavioral one. How do you get people to do what apps tell them? And I suspect I would be part of the problem there.
I think also one of the issues is there's already been spoofing on the notifications. So that's going to be a big problem.
That's right. That's a real problem, actually.
So you get a text message that looks like it's official, but when you click on the link, it's after some spam bot or some whatever, right? So there has to be a way of making sure that you don't lose the trust on that. So I think trust is like really key thing here, like, and that's going to be the challenge for the Irish government is to convince us that we should have enough trust in it and that it will actually work. And it will serve the public health. Like we all want it to serve the public health. Like it's not an anti-technology for the sake of anti-technology. We want to know it works, and we want to know we can trust it.
Yeah, I think that's very important as well, because I think that there should be a very clear communication to the public. Like, okay, this is going to be the only channel that the public health authority will communicate with you if there is a notification. Right, and if it's come on from other channels, don't trust them or whatever. I think that's really important, unless there will be a lot of scams, yeah, from this COVID thing.
Okay, and I'd like to thank all our panelists for a very informative discussion, very technical, and I think the work that experts like yourselves are doing is very important for ordinary people, because we really rely on being able to have access to this sort of information to make informed decisions, because ultimately it'll be individuals who'll be making those decisions whether to download the app or not. I'd like to thank everybody who stayed to the end and watched us, and particularly those people who sent in questions. We are going to be uploading the webinar afterwards. You'll be able to find it on the Digital Repository of Ireland website. And I hope you all have a lovely evening. Thank you very much, everyone.